Chapter 11, Diseases and Their Prevention. A disease is an illness that affects the health of a person. When a person falls sick, he is not able to do functions properly. Disease is an improper functional condition of the body. There are certain diseases which can be passed from one person to another. These diseases are infectious and are called communicable diseases. They are caused by small living organisms. These living organisms are called germs or pathogens and can be seen only under a microscope. These germs are of various kinds as bacteria, viruses, protozoa. Disease-causing germs. Bacteria. These tiny single-cellular organisms are neither animals nor plants. Bacteria are all around us in the air, soil, water, and everything we see. Some bacteria can cause diseases. Bacteria cause cholera, pneumonia, typhoid, leprosy, and food poisoning. Viruses. Viruses are not alive but become active inside a living body. They are particles shaped like balls or rods, many times smaller than bacteria. They cause many diseases such as common cold, flu, mumps, polio, chickenpox, and measles. Protozoa. They are tiny unicellular animals that cause diseases like malaria, dengue, and dysentery. Communicable diseases. The organisms that cause communicable disease can spread from one person to another through several sources like air, food, water, touch, insects, and animals. Most communicable diseases are caused by small life forms. Some common and serious communicable diseases are given below. Cold. There are over 200 viruses that can give you a cold. Cold viruses spread very quickly. They like to hang out where there are lots of people. If someone sneezes or coughs, the germs fly out looking for someone else to land on. Your hands that you cough or sneeze on can pass on the cold virus to everyone they touch. What you can do to stop cold from spreading? Wash your hands a lot. Cough or sneeze into a tissue. Throw tissue away in a bin down the toilet. Go to bed and sleep if you feel tired. Drink lots of water or juice. Suck cough candies to make your throat feel better. Not too many, they can hurt your teeth. Hand washing, throwing a tissue in a bin. A boy is sneezing, using tissue paper. Whooping cough. It is a bacterial disease commonly seen in children. Children suffer from a brassy cough, watery eyes, and often vomit. This disease can be prevented by vaccination. Pneumonia. Pneumonia is an infection of the lungs that is caused by bacteria, viruses, fungi, or parasites. It makes it difficult for a person to breathe. A person suffering from pneumonia has shaking chills, high fever, fast breathing, and shortness of breath, cough, vomiting, and chest pain. This disease needs treatment with heavy doses of antibiotics. A kid suffering from pneumonia. Tuberculosis or TB. It is an infectious disease that is caused by a bacteria. TB primarily affects the lungs, but it can also affect organs in the central nervous system and circulatory system, among others. However, when symptoms are present, they include unexplained weight loss, tiredness, fatigue, shortness of breath, fever, night sweats, chills, and a loss of appetite. Symptoms specific to the lungs include coughing that lasts for 3 or more weeks, coughing up blood, chest pain, and pain with breathing or coughing. A BCG vaccine can prevent this disease. Influenza or flu. There are several types of flu viruses. A virus is a germ that tries to get into a body cell where it will take over and produce more germs. If your body is healthy, it will fight off the virus. But for babies, old people, and anyone who is already sick, their bodies may not be strong enough and they could need help from the doctor. A person who suffers from flu has a fever, body aches, cold, shivery, and a dry cough. Don't go to work or school or sleep in a room with other people during the first few weeks of treatment for active tuberculosis. Use a tissue to cover your mouth anytime you laugh, sneeze, or cough. Put the dirty tissue in a bag, seal it, and throw it away. Wear a surgical mask when you are around other people during the first 3 weeks. Wearing surgical masks. Swine flu. Swine flu is a respiratory disease caused by a strain of the influenza virus known as H1N1. The virus enters the body through inhalation of contaminated droplets or is transferred from a contaminated surface to the eyes, nose or mouth of a person. This virus has not previously been identified. It affects humans, birds and swine, pigs. Although the strain may have originated in pigs, it is now a wholly human disease and is being transmitted from person to person. Swine flu symptoms. Some of the symptoms of swine flu are sore throat, cough and fever. One should also consult a doctor in case of body ache, vomiting and acute gastrointestinal symptoms like diarrhea and nausea. Symptoms of swine flu. Precaution and treatment. Swine flu spreads from people to people through contact. The infection spreads when a person comes in close contact with an infected person. The simple way to minimize the risk is by covering the mouth and nose while coughing and sneezing and wearing a mask while going close to the infected person. Maintaining high level of hygiene is also necessary. Frequently wash your hands with soap and water. However, the best way would be to get in touch with your doctor who can help you get the right treatment. Measles. Measles is a serious illness. It is caused by a virus. It can lead to other serious illnesses. Most children have measles, but adults can have complications if they get measles. Suffering from measles. Feeling miserable and unwell, having a headache, high fever, runny nose and cough, and red rashes all over the body are symptoms of measles. A vaccine given in childhood may protect us from measles. The treatment of measles should include vitamin A medication for 2 days, starting as soon as a measles diagnosis is made. This treatment has shown to decrease the risk of blindness and death. Vaccination. Diphtheria. Diphtheria is a bacterial infection in the upper respiratory tract. It usually spreads through the coughing and sneezing of the sick person, which releases germs in the air. The infection can also spread by touching the handkerchief, towel, utensil, or anything touched by the mouth of the infected person. Typically, it is characterized by sore throat, swollen neck glands, high temperature, and breathing difficulties. Diphtheria is caused by a pathogenic bacteria. This bacteria multiplies rapidly, spreading through the upper respiratory tract, where it causes inflammation. In more serious cases, diphtheria produces a toxin which can enter the bloodstream to involve the heart, brain and nerves. ADPT vaccination is given to children to protect them against this disease. Some airborne diseases are non-communicable such as allergies, asthma and anemia. Deficiency diseases. Deficiency diseases may be caused either by deficiency of a nutrient or due to overnutrition. They are not spread from one person to another. Germs or viruses are not responsible for these diseases. Some common deficiency diseases are anemia. Anemia is a non-communicable disease. It cannot spread from one affected person to another person. It is the condition where blood of the person gets impoverished. The main reason of this disease is the deficiency of iron and vitamins in the diet of the person. Tiredness and palpitation, awareness of heartbeat, shortness of breath, dizziness, fainting, angina, chest pain, headache or leg pains, pale complexion are common symptoms. Anemia can be prevented if it is caused due to vitamin deficiency or iron deficiency. This can be done by including the deficient nutrients in the diet. Allergies. An allergy in your body is overreaction to something that usually does not bother most people. For example, grasses, pollen, dust mites, and animal fur can cause trouble for some people. The unfavorable reaction of the body to these agents, which are otherwise harmless, is known as an allergic reaction. It may be in the form of a rash, boils, sneezing, swellings, etc. Unfortunately, allergies cannot be completely prevented. However, they can be cured by the administration of the right sort of medication. It is also important for the sufferer to be aware of what material might prove to be a potential allergy for him or her. Keeping away from any such allergy might be the first step towards a healthier life. Asthma. Asthma is also caused by an allergic reaction. People who suffer from this chronic condition are said to be asthmatic. A person has difficulty in breathing as the windpipe swells in reaction to the allergy, leaving little place for air to pass through. The patient gets asthma attacks when exposed to the allergens. Precautions. Drink boiled water in plenty. Avoid overeating. Take light dinner 1 hour before going to bed. Avoid tobacco, wine and smoking. Keep rooms well ventilated. Avoid air conditioners, coolers and direct air of fan. Avoid smoking, fresh air. Ways to maintain hygiene. Hygiene is an essential component of healthy living and preventing disease. Adopting hygienic practices in the community, schools and houses prevent innumerable infectious diseases. A few simple ways that can maintain hygiene and prevent diseases from spreading are general hygiene. Keep the cooking, washing and utility area and kitchen clothes clean. The kitchen surface and the floor should be regularly cleaned. Kitchens left dirty in the night attract insects which are carriers of infection. Try and keep your kitchen free of rats, cockroaches and flies. To keep a neat and clean bathroom, stick with liquid soap instead. It does not stick to the surfaces or cause unwanted soap scum. Wipe the toilet seat and clean any dirty surfaces with sanitizing wipes or a bleach water solution. Keep a bin to throw sanitary napkins or